Our next three presenters will be Lieutenant Commander Kate Pink, Lieutenant Andrew Park, and Kayla Davis. Lieutenant Commander Kate Pink is an Environmental Health Officer with the Indian Health Service. Pink is a Registered Sanitarian and Registered Environmental Health Specialist and Certified Professional in Food Safety from National Environmental Health Association. She's also a Certified in Public Health from the National Board of Public White River Service Unit in White River, Arizona. She has been with the IHS since 2016 and was commissioned to the U.S. PHS in December 2017. She has since served at two duty stations, Fort Yuma Service Unit and in her current duty station in White River, where she became the Office of Environmental Health and Engineering Branch Leader within the WRSU Incident Command Structure from March 2020 to March 2021. Her background includes a Master of Science in Environmental Health from East Carolina University and a Graduate Certificate in Epidemiology from the University of Illinois. Pink is a North Carolina Registered Environmental Health Specialist, a Certified Child Passenger Safety Technician, and a ServSafe Certified Food Manager, Instructor, and Proctor. Lieutenant Andrew Park is an Environmental Health Officer with Indian Health Service, stationed at the Elko Service Unit in Elko, Nevada. He has been with the IHS since 2019 and was commissioned to the U.S. PHS in March 2021. Elko Service Unit is his first duty station with IHS, where he served as the Office of Environmental Health and Engineering Branch Leader within the ESU Incident Command Structure from July 2020 to August 2021. His background includes a Master of Public Health from George Washington University, a Bachelor of Science in Bioenvironmental Science from Texas A&M University, Health Examiners and Associate Safety Professional from Board of Certified Safety Professionals. And Kayla Davis is an Environmental Health Specialist with Indian Health Service at the Western Arizona District Office in Tempe, Arizona. She has been with the IHS since 2012. She has since served at two duty stations, the Shawnee Service Unit servicing the southwestern tribes of the Oklahoma City area office and her current duty station in Tempe. Her background includes a Bachelor of Science in Environmental Science from Haskell Indian Nations University. She is currently completing her Master's in Public Health with an emphasis in health promotion from the Melanie Zuckerman College of Public Health at the University of Arizona. Ms. Davis is an Oklahoma Registered Professional Environmental Health Specialist, a Certified Child Passenger Safety Technician, a ServSafe Certified Food Manager, Instructor, and Proctor, and a 2020 Indian Health Service Injury Prevention Epidemiology Fellow.
Good morning and welcome to the first part of our presentation focused on the U.S. Public Health Service. This PowerPoint was put together by the Environmental Health Officer Professional Advisory Committee, commonly referred to as EHOPAC. My name is Lieutenant Commander Kate Pink, and I'm joined by Lieutenant Junior Grade Andrew Park. I am a Field Environmental Health Officer stationed with the Phoenix Area Indian Health Service out of the Eastern Arizona District in White River, Arizona. I've been in the Corps for almost 4 years.
Good morning. I am a Field Environmental Health Officer stationed in the Phoenix Area Indian Health Service out of the Reno District in Elko, Nevada. I was recently commissioned in March of this year, and with that, we'll continue with the presentation. The Commission Corps' official service motto is In Officio Salutis, or in the service of health. This motto embodies Commission Corps' officers' dedication to the service and work we do on a daily basis. While the U.S. Public Health Service has historic roots planted as far back as the late 1700s, the U.S. Public Health Service Commission Corps was officially established in 1889 and is solely committed to protecting the public's health. The Commission Corps is part of the U.S. Department of Health and Human Services and is overseen by the Assistant Secretary for Health. Our current Assistant Secretary for Health is Admiral Rachel L. Levine. The U.S. Surgeon General and the Deputy Surgeon General provides operational command of the Commission Corps. Our current U.S. Surgeon General is Vice Admiral Vivek Murthy. As I've just mentioned, the U.S. Public Health Service has historic roots planted as far back as the late 1700s. On this slide, you can see just a few of the historical events that helped shape the Commission Corps into what it is today. I'll give just a quick overview. In 1798, John Adams signed into law the Act for Relief of Sick and Disabled Seamen, which triggered the creation of the Marine Hospital along major American waterways. In 1870, the Marine Hospital Service centralized hospital administration under the leadership of the supervising surgeon, a role that is known today as the Surgeon General. In 1871, the first supervising surgeon, John Maynard Woodworth, adopted a military model for his medical staff, assigned a cadre of mobile uniformed physicians to various Marine hospitals. In 1878, the National Quarantine Act was passed, and the Marine Hospital Service played a pivotal role in thwarting the spread of global epidemic diseases such as smallpox and yellow fever. In 1889, Congress established the U.S. Public Health Service Commission Corps within the Marine Hospital Service. In 1912, Congress broadened the responsibility of the USPHS Commission Corps. Now, the Commission Corps was authorized to research human diseases, sanitation, water supplies, and sewage disposal. In 1930, the Parker Act expanded public health service opportunities to non-physicians. In 1955, the Indian Health Service, where many environmental officers worked, was established. In 1979, the Department of Health and Human Services was established. And in 1999, the first dedicated disaster response mission for the Commission Corps occurred. The Commission Corps of the U.S. Public Health Service is one of the 8 uniformed service and is the only one dedicated solely to protecting America's public health. We are made of over 6,000 public health professionals dedicated to addressing public health issues and providing clinical care. We are inspired by the call to serve vulnerable and underserved communities through addressing public health issues. The mission of the Commission Corps is to protect, promote, and advance health and safety of our nation. We accomplish this mission by putting into practice the following core values: leadership, integrity, excellence, and service. Commission Corps officers are expected to demonstrate these values both in uniform and out of uniform. Our service is comprised of 11 different professional categories that are needed to address public health and provide clinical care. Some of these specialties include physicians, dentists, nurses, pharmacists, clinical and rehabilitation therapists, dietitians, engineers, health service officers, scientists, veterinarians, and of course, environmental health officer, or as we often call EHOs. Currently, the U.S. Public Health Service Commission Corps consists of more than 6,000 officers in about 800 locations, spanning across all 50 states and numerous foreign assignments, including World Health Organization and World Bank. While a majority of commission officers are stationed within agencies of the Department of Health and Human Services, such as Centers for Disease Control and Prevention, the Food and Drug Administration, Indian Health Service, National Institute of Health, and many others, officers are also detailed to other executive departments and agencies, such as Department of Homeland Security, Federal Bureau of Prisons, U.S. Department of Agriculture, and State Department and local agencies. While Commission Corps officers work in a variety of duty stations and categories, we all work to protect, promote, and advance health and safety. We provide essential health services by going to areas where most do not go to provide care for vulnerable and underserved populations. We serve on the front line of public health emergencies, responding quickly to natural disasters, disease outbreaks, and global public health emergencies. We also serve on humanitarian missions. We utilize our experience, skills, and networks to provide leaderships within the U.S. Department of Health and Human Services and through the federal government to lead public health program and policy development. And finally, we advance innovation and science by working at the forefront of medical challenges like COVID-19, cancer, and the opioid crisis. Now we will discuss a new component of the Corps, our Ready Reserve Corps. The Coronavirus Aid, Relief, and Economic Securities Act, CARES Act, signed into law on March 27, 2020, provides both the authority and funding for establishment of Ready Reserve Corps, the reserve component of the Corps. Applicants to Ready Reserve must meet the same appointment requirement as regular Corps. The Ready Reserve Corps will provide trained and ready personnel to fill critical public health needs and will support the USPHS Commissioned Corps' capacity to respond to regional, national, and global health emergencies and improve access to health services, preserve clinical care position by maintaining a surge capacity of health professionals available for deployment without jeopardizing the service of clinicians in hard-to-fill roles, offer an opportunity to serve for mission-driven clinical and public health professionals who cannot commit to a full-time active duty position in the USPHS Commissioned Corps, enable access to highly specialized skill sets that would be impractical in full-time active duty position. For more information about Ready Reserve Corps, please visit usphs.gov and click on Ready Reserve. As a member of the U.S. Public Health Service Commissioned Corps, you will receive uniform service benefits. This includes comprehensive, low-cost medical, dental, and vision care for yourself and your dependents, enrollment in the Uniform Services Blended Retirement System, and post-9/11 GI Bill education benefit, which can be transferred to dependents after 10 years of service. As mentioned earlier, officers have the opportunity for a diverse career and professional growth. There is also the potential to transfer from civil service or other uniformed services. And of course, there are opportunities to serve in response to disasters and epidemics. If all of this sounds like a career for you, please consider applying. Candidates must meet basic requirements and basic education and training requirements. Additionally, candidates must meet height and weight standards, maintain physical fitness, and be medically qualified. For specific questions regarding medical eligibility, please email cadmedical@hhs.gov. And finally, candidates must also be committed to displaying respect for our country and service by wearing the USPHS uniform. To become an officer, applicants must secure a position in an agency where USPHS officers serve and complete the commissioning process. Oftentimes, this is done simultaneously during the 6 to 9 months commissioning process. Another key component of the U.S. Public Health Service Commissioned Corps is our ability to stand ready and deploy when needed. While each officer is assigned to a primary duty station, officers are also expected to maintain readiness in the event they are needed for deployment. The Office of the Surgeon General, through Commissioned Corps Headquarters, is responsible for the coordination of readiness and deployment for domestic and international operations, maintaining up-to-date deployment team rosters and individuals, humanitarian assistance, disaster relief, emergency response, and global training. While this list is not all-inclusive of potential scenarios where Commissioned Corps officers may be deployed, it provides a great sense of how flexible and versatile a Commissioned Corps officer must be in order to respond to various incidents. The U.S. Public Health Service Commissioned Corps has continuously served on the front line throughout the COVID-19 pandemic. So far, more than 4,500 officers deployments have taken place, accounting for roughly 200,000 deployment days. Commissioned officers continue to be at the forefront of COVID-19 response, serving multiple roles. These roles include leadership, operations, screening, quarantine, case management, and human services. While all professional categories have proven to be invaluable throughout the incident, environmental health officers have also been tasked with many other responsibilities throughout the last few months and have proudly served with other Corps officers in the front lines. We would love for those interested to join our noble effort. The USPHS Commissioned Corps offers rewarding careers for public health professionals who desire to protect and promote our nation's health and treat those most in need. We are currently recruiting service-driven clinicians and public health professionals in our 11 professional categories, including physicians, nurses, dentists, veterinarians, and environmental health officers. If you are interested, please visit usphs.gov for more information. I will now pass it over to Lieutenant Commander Pink, who will discuss who environmental health officers are.
How do environmental health officers fit into the U.S. Public Health Service, you may ask? Environmental health officers conduct a wide variety of activities by providing services in general environmental health, health promotion, and disease prevention, and injury prevention and occupational safety. Additionally, you can find EHOs in leadership positions supporting public health programs. EHOs also provide highly specialized services in areas such as counterterrorism, industrial hygiene, health physics, hazardous waste, and biomedical and epidemiological research. EHOs conduct a wide variety of activities. Some may even say our specialty is being a generalist. We conduct surveys, investigations, research, training, consumer education, technical assistance, regulatory compliance, and codes and standards development. We also respond to public health emergencies such as natural disasters or infectious disease outbreaks. We review and regulate medical products and devices and develop and monitor national health priorities, just to name a few. So how does one become an environmental health officer? There are two opportunities. For students, there is the Junior Commission Officer Student Training and Externship Program, often referred to as the JRCOSTEP. This is an internship over the summer where students can experience what life is like as an EHO while still enrolled in school. For those students that may be graduating soon or are already in the job market, you can also become an EHO by applying to General Active Duty. We will start by discussing the JRCOSTEP. Students in health-related undergraduate, master's, and doctoral programs can train alongside active duty officers during their school breaks as part of the JRCOSTEP. Participants are paid, receive health benefits, and travel and housing allowances. On your screen, you can see some pictures of former JRCOSTEPs in action. In order to be accepted into the JRCOSTEP, there are a few requirements that must be met. The first requirement is that students must have already completed at least 2 years in an accredited bachelor's program or 1 year in accredited master's or doctoral program for environmental health, industrial hygiene, or occupational health. Students must complete a 31 to 120-day tour and must return to school after the completion of the JRCOSTEP. In other words, one cannot do this after graduation. In addition, students must meet the medical and security requirements and also clear an appointment board review process. Once all application materials are submitted, including medical and security documents, the appointment board process essentially involves a file review and an interview by public health service officers. Another key feature of the JRCOSTEP is that students are free of any obligation or responsibility to the U.S. Public Health Service after graduation. Here's a visual representation of the JRCOSTEP application process. Applications are submitted online through the Learning Management System, or LMS, which applicants will be granted access to during the process. Students are initially screened for general requirements and then are requested to submit additional required materials and undergo the medical and security screening process. The 2022 JRCOSTEP application window was open through September 30th, 2021. Please keep your eye out for the next application window in summer of 2022. The JRCOSTEP offers many competitive benefits to interested students. First, the Junior COSTEP is paid internship program. Junior COSTEPs are commissioned officers serving at the ensign rank and also receive ensign pay. This is equivalent to the 01 rank of the military officer pay scale. In addition, if relocation is necessary, relocation will be paid for. During a student's time as a junior COSTEP, they will receive the same medical benefits as an active duty U.S. Public Health Service officer and earn 2.5 days of annual leave each month. As an example, this would result in 7.5 days of leave over the course of a 90-day junior COSTEP tour. One of the biggest benefits of the junior COSTEP is the opportunity for field experience. Junior COSTEP preceptors make it a priority to get students out in the field and practice boots on the ground public health practices. Junior COSTEPs often have the opportunity to participate in inspections and special projects at their duty stations. Finally, I again want to mention there's no service obligation to the public health service after graduation. The Junior COSTEP program is a great way to explore the U.S. Public Health Service Commission Corps and to see if it's something you're interested in pursuing as a career. We will now transition to talk about the various requirements for general active duty in the U.S. Public Health Service Commission Corps. There are a number of requirements to become an active duty public health service officer. You must be a native or a naturalized citizen of the United States. You must be less than 44 years of age. You must have less than 8 years of prior active duty service in other uniformed services, and you must meet suitability, professional, medical, and security requirements. The academic requirements vary from category to category. To become an EHO, there are multiple degree paths that are acceptable when applying to the U.S. Public Health Service. The first and most common degree path is having a bachelor's or master's degree in environmental health from a program that is accredited by the National Environmental Health Science and Protection Accreditation Council, or more commonly referred to as EHAC. In addition, applicants can have a bachelor's or master's degree in environmental health, occupational health and safety, industrial hygiene, or health physics from a program accredited by the Accreditation Board for Engineering and Technology, or ABET. Lastly, applicants can have a master's or doctoral degree in environmental health, occupational health and safety, or industrial hygiene from a program accredited by the Council on Education for Public Health, or CEPH. Candidates with a degree from a CEPH accredited program must also possess a current certification as a registered environmental health specialist or registered sanitarian, or REHS/RS in training by the National Environmental Health Association, also known as NEHA. Being an officer in the U.S. Public Health Service and wearing the uniform comes with certain expectations. Applicants are expected to exemplify excellence, both in officership and leadership, to become an expert in their field, to advocate for public health, to proudly wear the uniform daily, to maintain the various forms of readiness, and to be flexible. The opportunities within the U.S. Public Health Service are based on the needs of the service and federal agencies at the time, and emphasis on certain agencies or opportunities may shift over time. The active duty application process is similar to the junior COSTEP application process. The main difference is that the responsibility of securing a federal position lies on the applicant. In other words, individuals need to apply to both the U.S. Public Health Service and whichever agency you're looking to work for separately. The USPHS will not place you at an agency. However, there are resources available to applicants through EHOPAC in order to assist you in securing a federal position. Applicants will be commissioned as an officer only after they have been recommended for service by an EHO appointment board and have been hired by an agency. Lastly, I do want to point out that the EHO application window is currently open. I would encourage those interested in applying to visit usphs.gov to start the process. Inter-service transfers and former commissioned officers, including former junior COSTEPs, are also encouraged to apply at this time. We will now switch gears again to discuss some of the challenges and considerations when it comes to applying to the U.S. Public Health Service Commission Corps as a junior COSTEP and active duty officer. We will also talk about some helpful tips and characteristics of a successful application. Let's start off by talking about some helpful tips when applying. The first tip is to get familiar with the application process. On the slide, you will see a link to the U.S. Public Health Service website where you can apply and submit questions and the phone number for the call center. I would strongly recommend starting and submitting your application early in the process and not waiting until the last minute. The application has several parts, many of which require time to complete, such as gathering references, conducting your medical screening, and so on. This may sound obvious, but it has happened in the past where all the required application components have not been submitted. So please ensure all your application components are submitted. I also strongly recommend keeping copies of your application. Things happen and copies of original application materials may be requested through the process. It is always better to have copies than to redo a portion of your application. Additionally, if you are a former junior COSTEP applying for active duty, having a copy of your junior COSTEP application makes it a little easier to fill out the active duty application. So as the application process is very similar, you will not have to look everything up again. It's also important to understand and meet the eligibility requirements. Each category has specific appointment standards, and for the EHO category, these can be found on the U.S. Public Health Service website and also on the EHOPAC website. Lastly, my final tip is to follow up. Reach out to Commission Corps headquarters or a current officer if you have questions about your application process. So what makes a successful application? Listed here on the slide are some characteristics of a successful application for both active duty and junior COSTEP. Please keep in mind that these are just some characteristics, and just because they are all met does not guarantee selection. The first characteristic is a completed application. As mentioned earlier, please ensure all components of your application are submitted on time. The second characteristic is sufficient GPA. To be considered for active duty or the junior COSTEP, applicant needs to have a GPA greater than 2.8. Submitted references should be supportive and highlight your strengths as an applicant. You also need to be able to obtain medical and security clearances and not have any conflicting obligations. For instance, applicants should not have a conflicting job or other obligation that would impact their ability to serve. For general active duty applicants, you need to be able to secure a federal position. As mentioned earlier, the U.S. Public Health Service does not find a position for you, so it's a good idea to begin looking for a job while you are also applying to the Public Health Service. In addition, your application can expire, generally within 1 year. Agency hiring paperwork needs to be submitted prior to the 1 year after being professionally boarded. Lastly, for junior COSTEP applicants, you must return to school after the completion of your junior COSTEP tour. Finally, we will discuss various resources that will help you during the application process and to keep up to date on EHO opportunities within the U.S. Public Health Service. The first link on this slide takes you to the Opportunities for Students section on the USPHS website. This site includes information on the junior COSTEP and on the application process. The second link takes you to the EHO specific information on the USPHS website. The third link is the EHOPAC's Facebook page, where environmental health officer specific information is posted. This may include webinar announcements, environmental health in the news blurbs, and U.S. Public Health Service information. The fourth link takes you to a website through the Indian Health Service where the experiences of former junior COSTEPs are stored. Here you can read firsthand narratives from former junior COSTEPs to get an idea of the opportunities available through the program within the Indian Health Service. The final link takes you to the U.S. Public Health Service Commission Corps Doctrine, which provides an in-depth outline of the Commission Corps. I will now hand it off to Lieutenant Junior Grade Park.
We will now begin the Q&A portion of this recruitment webinar. While we wait for questions, we will bring up our contact slide so that you may jot down or screenshot the information for future reference. We encourage you to use our contact information shown on the screen to reach out if you have any questions. Thank you all for joining us for this webinar.
Good morning, and thank you for joining us for the IHS Phoenix Area Institutional Environmental Health Response to COVID-19 presentation. This will be presented by Lieutenant Commander Kate Pink, Lieutenant Junior Grade Andrew Park, and Miss Kayla Davis. Our objectives for today, we're going to provide an overview of the IHS Phoenix Area Division of Environmental Health Services, or DEHS, institutional response efforts to COVID-19 and our support activities. Want to increase your knowledge of environmental surface disinfection assessments and provide an overview of respiratory protection, the steps required, and issues that we encountered. Initially, there was some confusion in the hospital setting around who needed what personal protective equipment. Meaning, if you were providing direct patient care versus indirect services, but you're still working in the main hospital, or for those working in auxiliary buildings. So who needed what PPE? PPE was being allocated to patient care, but there were a lot of questions and concerns from non-patient care staff. One duty that environmental health staff were tasked with was to educate non-patient care staff on personal protective equipment, specifically mask wearing, distancing protocols, and consult on other engineering or workplace controls and cleaning and disinfection procedures. Then questions and concerns were brought back to the local incident command. This lessened confusion within those departments and got more done to keep staff safe, such as identifying where engineering controls were needed. In the Phoenix area, service units had many PHS officers deploy, but there were not as many deployed to us, as well as from other agencies. One service unit received approximately 45 deployed nurses, and when the first set of nurses arrived, it was obvious within the first few days that an orientation and training program was needed. Some nurses were coming in with little to no recent clinical experience and were unaware of extended use procedures authorized by the CDC for personal protective equipment. Another duty assigned to environmental health staff was to review PPE levels at the service unit, what the procedures were, and how they conformed to the CDC guidance. After this discussion, the deployed nurses felt more comfortable. All subsequent cohorts of deployed nurses received an orientation from IHS staff on service unit policies and procedures, safety and infection control, along with PPE donning and doffing and N95 fit testing if needed, and then an additional orientation specific to their service unit. We also provided services to healthcare support entities such as behavioral health or treatment centers. Tribal members were having a hard time isolating in their homes. Many of the homes were built in the 70s and 80s and were not large enough to accommodate family members having their own room and bathroom. It was determined that isolation quarantine sites were necessary to reduce the spread. Locations were identified but needed staff. Environmental health staff were able to provide PPE and cleaning and disinfection training to approximately 79 isolation and quarantine staff members over the months that the sites were being set up. These sites were not authorized to open by tribal council until the staff members were trained, and therefore that service was an integral part of the healthcare circle. The isolation quarantine staffing and services were provided by one of the local treatment centers. And as well, many detention centers do not have a dedicated medical staff member and therefore do not have full-time support internally to address training, PPE, and other procedures needed to protect inmates. All staff received training from IHS on donning and doffing, cleaning and disinfection, and cohorting. Additionally, environmental health staff provided targeted training to the worker inmates who were responsible for much of the cleaning and laundry. They were fit tested, and one detention center staff member was trained on how to fit test subsequent trustee inmates.
Another facility consultation and safety officer support done by the DEHS in Phoenix area included the Infection Control Assessment and Response, also known as ICAR. Given the nature of COVID, the ICARs were conducted remotely using the camera function on a mobile device. The CDC training and consultation team called to a designated member of the service unit to begin the ICAR. With the ICAR, there were 16 members to include travel departments such as environmental services staff and operation and maintenance, IHS staff such as the service unit executive team, safety officer, infection control officer, environmental health officer, and CDC training and consultation team. The CDC staff made 8 recommendations for 2 facilities concerning items such as PPE, which includes routine auditing for PPE and hand hygiene audit to ensure ongoing adherence for all staff, environmental infection control guidance, strategies to mitigate staffing shortages, telehealth strategies, and healthcare personnel safety for the development and implementation of policy and procedure.
Due to the ongoing pandemic and the hospital safety officers being pulled away from their normal duties, one of the Phoenix Area Medical Center safety director requested DEHS staff support at the hospital. Safety officer support duties consisted of personal protective equipment observations to ensure staff are donning and wearing N95s properly, hazard surveillance rounds of hospital, surrounding labs, clinics, and maintenance departments, ergonomic surveys at the request of staff, conducting business occupancy fire drills, and workplace incident and injury follow-ups and closeouts on iStar. iStar is a reporting database utilized by IHS to report and track workplace-related injuries, illness, hazardous conditions, as well as patient injuries and medication errors, including near misses.
Environmental surface disinfection assessment of clinical settings were also conducted using the adenosine triphosphate ATP monitoring. Effective environmental surface disinfection is critical in responding to COVID-19, especially in clinical settings. To quantify the effectiveness of the surface cleaning of the facility, the ATP swab assessments were conducted to monitor the efficacy of surface cleaning procedures. ATP is an energy molecule found in all living cells that allows cellular metabolism to take place. All organic matters contain ATP, including blood, saliva, and bacteria. In healthcare facilities, organic matters such as bodily fluids, blood, and specific bacteria left in surfaces can become a point of cross-contamination between patients and staff, leading to infection if not properly cleaned. Therefore, the detection of ATP on a surface after cleaning is an indication of improper cleaning. Bacteria or bioburden that can support bacterial growth is still present on the surface. The ATP surface test contains an enzyme called luciferase, which produces bioluminescent reaction when it comes into contact with ATP. Using the bioluminescent technology, low levels of ATP collected can be measured with the device. The ATP swab assessments were conducted to monitor the efficacy of surface cleaning procedures. Areas that were monitored included both clinical areas such as exam tables, blood pressure cuffs, also areas such as that are public, such as handrails and restrooms. 50 locations were swabbed at each assessment. The environmental surface disinfection assessment not only included the ATP swab assessment, but also included programmatic and educational interventions. These interventions included the review and revision of policies and procedures, defining roles and responsibilities of staff, review of chemical inventories in the facility, specifically identifying list and disinfectants for COVID-19, delivering environmental surface disinfection training with set disinfectants, and implementation of revisited policies and procedures. 2 clinics in the Phoenix area participated in the assessment, with a total of 8 assessments were conducted. By implementing programmatic and educational interventions, that was supported by quantifiable evidence, we were able to improve the environmental surface disinfection of the Clinic A dramatically.
Moving on to community-based events, and we'll start with testing. DEHS staff were able to provide both logistical support and personnel to multiple community-based collection events throughout the Phoenix area in order to provide expanded access to COVID-19 testing to those communities in need. These community-wide events were provided in partnership with local tribes, state partners, and the Army National Guard. DEHS staff from the Western Arizona District attended and assisted at 2 mass vaccination events hosted by an IHS hospital, as well as smaller ongoing clinics. The mass vaccination event was a collaborative effort between the hospital's healthcare providers, the U.S. Public Health Service, safety officers, environmental health specialists, and many other volunteers from various backgrounds and areas of expertise. The smaller clinics were a collaboration between DEHS and public health nurses. Over 1,100 eligible patients became fully vaccinated as a result of the vaccination clinic efforts. The 2019 novel coronavirus outbreak increased the use of respirators, specifically N95s, to protect the health of employees. Proper respirator use is required for healthcare workers that are expected to interact or be exposed to individuals with infectious respiratory disease. As a result, there was an increased demand for fit testing among healthcare workers, first responders, and other essential employees in the tribal communities we serve. By March 2021, over 17 fit testing events had taken place. Over 700 employees, both service unit and tribal, had been fit tested. 13 individuals were trained to conduct fit testing, and community partnerships were formed to build tribal capacity for respiratory protection. The increase in fit testing provided us the opportunity to analyze how differently each service unit and individual's fit testing process was, and further resulted in the launch of a respiratory fit testing Train the Trainer pilot project.
As Kayla mentioned, due to the increased need for N95 fit testing and respiratory protection, a Train the Trainer project is being piloted by Phoenix area environmental health staff. The goal of this project is to increase consistency in training techniques and to build capacity in tribal departments and service units concerning respiratory protection. The project is comprised of 2 parts, the first being virtual and reviewing what is required by OSHA for respiratory protection, what equipment is needed, and the qualitative fit testing procedure. The second part is a hands-on session where the trainee will fit test a certain number of individuals while being observed by the trainer. There are designated trainers throughout the Phoenix area Division of Environmental Health Services that are authorized to perform the observations. Currently, 10 individuals from 8 different service units have successfully completed the virtual session. The hands-on sessions are ongoing. Some recommendations that we had for community partnerships and communication were when local incident command does not have a clear understanding of what environmental health specialists and officers do and what our role is within the community, this can lead to confusion. So the recommendation was for incident command teams to review current communication policies and procedures with environmental health staff to assure each part is clear on the flow of information during an incident to reduce confusion. Also, miscommunication with deployed nursing staff created confusion. This was resolved with the creation of the orientation program. So further recommendations, solidify that program in writing so it can be replicated should a future need arise, or if other service units need to use that as a template. And then ensure that all staff deployed to a service unit know what the incident command structure is, what the policies and procedures are, and who to report issues to if they should arise.
We also had recommendations regarding environmental surface testing. We identified there were gaps in cleaning and disinfecting frequencies and responsibilities between departments within the clinics. The recommendation was to have policies and procedures to clearly define the roles and responsibilities of respective departments in cleaning and disinfections within the facilities. Languages in the policies and procedures should be clear and avoid subjective languages such as needed. We also identified improper use and storage of cleaning and disinfectant supplies. Recommendation given to this was employees should understand the proper use of cleaning and disinfecting supplies by knowing the required contact time, as well as having proper storage of the cleaning and disinfecting supplies.
Observations and recommendations for staff training and respiratory fit testing. Our DEHS staff observed external programs using a variety of fit testing procedures. The recommendation was to confirm that programs utilize established written fit testing procedures to ensure consistency in a proper fit test. DEHS staff also observed a variety of train-the-trainer procedures throughout the service area. The recommendation was to establish a written train-the-trainer policy and procedure to ensure consistency and adherence to standard protocol. Provide additional DEHS train-the-trainer sessions to tribal entities to increase capacity and preparedness. Pilot a respiratory protection train-the-trainer program. In conclusion, DEHS staff were able to serve as safety officers, provide respiratory fit testing, access environmental surface disinfection, and communicable disease control. They have conducted environmental health assessments in healthcare settings, alternate care, recovery and surge capacity sites, drive-up testing sites, schools, child care centers, restaurants, gaming, and more. In addition, they were also deployed as IHS liaison officers to state emergency operations centers and were assigned to tribal incident command teams. DEHS staff members were able to mobilize multiple partnerships with tribes, states, and the Army National Guard to effectively provide essential institutional environmental health services. On behalf of the Phoenix Area Indian Health Service Division of Environmental Health Services team, thank you for giving us this opportunity to showcase our COVID-19 response efforts. We're now going to open the forum to questions.